my name is Jaden Roth, and this is going to be my head-to-toe assessment validation video. To start off, I'm going to set my intention and center myself. Then I'm going to gather my supplies. So I have my ID badge, my stethoscope, I have a pen light, and I have an alcohol swab. Then I am going to clean my stethoscope. And then I am going to perform hand hygiene. After that, I'll be entering the patient's room and providing an initial environment assessment. I'll make sure that both sides of the bed are free of tubes, lines, debris, or clutter. Then I'll make sure that the patient's IV is running at the appropriate and ordered rate according to the MAR. I'll make sure that the IV site is clean, dry, and intact. And then I'll make sure that all of the appropriate tubes are in the appropriate places, and that the bed is in the lowest position. Hi, my name is Jaden. I'm going to be your student nurse today. I'm just here to do a head-to-toe assessment on you. It's going to be about 10 to 15 minutes of a little bit of looking, a little bit of listening, and a little bit of touching. Is that okay with you?
Yes.
Awesome. Can you just confirm your name and date of birth for me, please?
No, owns 10/12/99.
Perfect. That matches the patient's ID band and matches the patient's electronic health record. And Noah, can you go ahead and tell me, do you have any allergies?
No.
Perfect. That's what I have listed here as well. All right. Well, now that I've verified that, I'm going to provide for privacy by pulling the curtain. Then I'm going to raise the bed to a working height and lower the side rail. We are going to start today by doing vital signs. Does that sound good?
Sounds good.
Okay, perfect. I'm just gonna do blood pressure. I'll put this on your finger. That's gonna do pulse and O2 saturations. I'll do respirations and a temperature. Perfect. All vital signs are as to be expected with no abnormal findings. Are you experiencing any pain today?
No.
No? Perfect. Next, I'll move into my general survey. Can you tell me where you are?
United Hospital.
Can you tell me why you're here?
Having a surgery.
Awesome. And what time of day is it?
It's about 8 o'clock.
Okay. Patient is alert and oriented ×4. Their mood is pleasant and cooperative. Their speech is clear and understandable. The patient is well groomed and appears to be able to maintain their hygiene independently. They are relaxed in bed in the supine position, and their nutritional status looks as if they are of healthy weight and hydrated. All right, Noah, next we're going to be moving into an assessment of your head. Is that okay? Okay, I'm just going to look here, make sure that all the facial features are symmetrical, which they are. Next, I'm just going to have you look up here, and I'm going to shine this light in your eyes. Pupils are equal, round, and reactive to light. There's no drainage coming from the eyes, ears, nose, or mouth. Can I check your mouth? Perfect. Oral mucosa is pink and moist. And then can I have you take a sip of this water for me, please? Did that go down okay?
Yes, ma'am.
Okay, and swallow is intact. Next, Noah, we are going to do your respiratory assessment. So I'll be listening to your lungs here with my stethoscope. Is that okay?
Okay.
Okay, awesome. So first, for the purpose of this video, this is the gown that I'm just going to pull down here to expose the chest. I'm going to look at the skin, make sure that the skin is intact and free of redness or swelling. The skin is also an appropriate tone for the patient's ethnicity. Next, I'm going to test skin trigger by pinching up by the clavicle. Skin returns promptly and is elastic. So then I'm going to move forward with auscultating the lung sounds. All right, I'm going to start over here. 1, 2, 3, 4, 5, and 6. All right, next I'm going to do the lateral sounds. 1 and 2. Lung sounds are equal and clear in all fields. Breathing is non-labored and lungs are expanding equally. While I am up here now, I'm going to go ahead and listen to your heart and do my cardiac assessment, okay? Awesome. So I'm going to start on the right side of the patient's chest with the aortic valve. Then I'm gonna move over to the left side for the pulmonic valve, down to Erb's point. Then I'm going to move to the tricuspid valve and over to the midclavicular line for the mitral valve. S1 and S2 sounds are present, rate and rhythm are as to be expected, and the characteristics show no abnormal findings. Okay, now I'm just gonna pull your gown up here and then I'm gonna help you sit forward so I can do the rest of your lung sounds, okay?
Okay.
Perfect. All right, moving to the back, the posterior. Here I see that the spine is aligned and centered all the way down the back. The skin is intact with no signs of redness or swelling, and the skin tone is appropriate with the patient's ethnicity. Breathing is still non-labored. Lungs are expanding equally. Now I'm gonna start listening. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Lung sounds are equal and clear in all fields. All right, now you can go ahead and lay back. Now that we have done your cardiac and respiratory assessment, we can go ahead and move along to your abdominal assessment. So I'm going to pull your gown up here and make sure that the blanket is at waist level. First, I'm going to start by inspecting. The abdomen contour is flat, skin is intact with no signs of redness or swelling, and skin tone is appropriate with the patient's ethnicity. Next, I'm going to listen. All right, so we have left lower quadrant, left upper quadrant, right upper quadrant, right lower quadrant. All right, valve sounds are present and active in all 4 quadrants. Next, I'm going to palpate the left lower quadrant, left upper quadrant, right upper quadrant, and right lower quadrant. No signs of masses or tenderness in the abdominal area. Noah, when was your last bowel movement?
About 2 hours ago.
Perfect. And when was the last time you peed?
Same.
Perfect. Any difficulty or pain with either of those?
No.
No? Okay, perfect. I am just going to get your side rail pulled up here, and then the next part of the assessment, we are going to be moving your hands and legs, okay? Awesome. The side rail is up, so go ahead and hold both your arms out in front of me, please. Skin is intact, upper extremities are symmetrical, and skin tone is appropriate with the patient's ethnicity. Go ahead and move your fingers for me, please. Perfect. Movement present and equal bilaterally. I'm going to have you close your eyes and tell me which finger I'm pinching on each hand, okay? What about this left hand?
My right finger.
Okay, and your right hand?
My pointer finger.
Okay, perfect. Sensation is equal and present bilaterally. Capillary refill is less than 3 seconds bilaterally. Next, I'm going to do the temperature of your skin. Temperature is warm and dry bilaterally. Now, I'm going to have you squeeze my fingers here. Perfect. Strength is equal, strong, and present bilaterally. And I'm going to feel radial pulses. Radial pulses +2 bilaterally, and then test for signs of edema. No signs of edema bilaterally. That was perfect. Now we're going to go ahead and move to your feet, okay? Okay, awesome. I'm just gonna uncover your legs here. Go ahead and wiggle your toes for me, please. Perfect. All right. Skin is intact, no signs of redness or swelling. Skin tone is appropriate with the patient's ethnicity. And lower extremities are symmetrical. Movement present bilaterally as well as equal. Okay, we're gonna do the same thing. I'm gonna pinch a toe and you're gonna tell me which one I'm pinching, okay?
Okay. My pinky.
Perfect.
My big toe.
Okay, perfect. Sensation present and equal bilaterally. Capillary refill less than 3 seconds bilaterally. Temperature warm and dry. Next, I'm going to have you pull your toes towards you. Perfect. And push your toes towards me. Perfect. Strength is strong and equal bilaterally. Now I'm going to feel pedal pulses. Fetal pulse is +2 bilaterally. Check for signs of edema. No signs of edema bilaterally. That was perfect. All right, Noah, well that is the end of my assessment. So I'm just gonna come over here, lower your bed into the lowest position. Make sure both side rails are up. Make sure that you have your call light. Here's that.
Thank you.
Perfect. Then I'm gonna make sure that your bedside table is within reach. After that, I'm going to clean my stethoscope. Perfect. Then I'll perform hand hygiene and I will document my findings when I leave the room. That is the end of my assessment.